Hello, everyone. This is Andrew Stalker, and this is my diversity story for CRM 703. While diversity can encompass many realms such as age, race, and gender, my diversity story is going to focus primarily on occupational diversity. I currently work as a lead coordinator for a large research company. As a lead coordinator, all study related activities are managed by me. I work hand in hand with the primary investigator to conduct the studies I run, and I run them according to the protocols that are associated with them. And while the PI is ultimately responsible for the study, it's the lead coordinator, me, that ultimately runs it. As the lead, I manage a team of other coordinators, research assistants, sub-investigators, and these sub-investigators are primarily physician's assistants, lab techs, EMTs, and paramedics. I'm responsible for ensuring that all members of the team are fully trained regarding the protocol and the completion of study-specific activities and procedures. I'm ultimately responsible for knowing any protocol I'm working on like the back of my hand. I have to know everything that's in there, what the inclusion-exclusion criteria is or are, um, what procedures go on which days, stuff like that. While most members of my team have a working understanding of the protocol, few, if any, grasp it in its entirety. I've worked in research for about 3 years, and I have a pretty firm understanding on the concepts of things like clinical equipoise and the clinical misconception. However, not everyone on my team understands these concepts. My story starts with one of the PAs that I work with. This PA, she has never worked in research before. She comes from a strong medical background and worked in the emergency room prior to coming into research. She's very knowledgeable and she's a great asset regarding the medical care of our subjects. However, she does have a difficult time grasping the innate differences between research and clinical care. On several occasions, she's conducted medical procedures on subjects that they had not been consented to, and this is a significant issue within the realm of research. I've spoken to her about it on several occasions, but she claims that as a medical professional, that it's her discretion to treat her patients according to what she thinks is best for them medically. I've explained to her that while I care for our subjects and I want what's best for them, we are not in the realm of treating them. We are a research organization. We're not a medical clinic. We are conducting research. We can refer them to medical providers if the need arises, but we cannot conduct medical procedures such as EKGs, blood glucose tests, and other types of tests if they're not explicitly stated in the informed consent that they sign at the study start. This has been a considerable issue, and unfortunately, she continues to do these things. This PA seems to think that because she's medically trained and because she is a physician's assistant, that she is somehow above the coordinator in the study. And I've tried to explain to her that ultimately what happens is if the protocol is not conducted according to what the protocol is, if it's not conducted appropriately, then usually it'll be the PI, the primary investigator, or the lead coordinator who have to go to bat for that. And they're usually the ones that will get in trouble through, FDA audits and other types of regulatory agencies. And I have a pretty strong responsibility in making sure that everything is done according to the protocol. And we cannot conduct anything on our patients, our subjects, that is not explicitly stated in the informed consent. And there have been multiple times where she was concerned about a patient, so she conducted an EKG, even though on the specific study that I'm talking about, EKGs they're not part of any visit procedure. And in the informed consent, each patient is told exactly what is to be expected of them, in so much as how much blood will be taken at each visit. So we cannot conduct extra tests just because we're concerned about something. That's not the way it works in research, and she doesn't seem to grasp that. And I've tried to instruct her on that, but she doesn't want to listen to me. And I've brought this to the attention of my clinical research manager, and they have spoken to this PA on several occasions regarding this issue, but nothing seems to be done. And it is frustrating, and it is going to cause significant issues when our monitors come and they recognize that these tests were done. Because I'm a stickler on making sure that progress notes are conducted at each visit and everything that is done is documented. And so these EKGs, these glucose tests that she's conducted, even though they're not in the protocol. I mean, a less honest person could just omit them. But in the realm of research, we need to be upfront. We need to be clear about what we're doing, and we need to be honest. And so I include these in the progress notes. So that is going to come back on us. And it is potentially very damaging. And so I would have to say, all in all, that this is probably a negative exchange, not a positive one. And any any thoughts, suggestions that anyone can offer, I would greatly appreciate, because this is an ongoing issue that I would like to get corrected as soon as possible. I do appreciate your time, and I thank you for watching this. Thank you.